So I think what we'd like to talk about today is, as a physician practice, what are my options on who I can and should be buying electronic health record software from?
Well, there are a couple of different alternatives. You can work directly with the EHR vendor. They typically have very large sales staff out on the street, and they'd be more than happy to send a representative to your practice and do a demo of their product. But if you have someone that you typically use in your practice to help with your IT needs, someone who's already servicing your computers and helping you acquire new gear when that's necessary, you can talk to them as well. In either event, you can typically find that you can get everything in one-stop shopping if that's how you'd like to go. The EHR vendor can access the hardware for you, and then certain hardware vendors also represent various EHR companies as resellers. I'm an advocate of the one-stop shopping approach because, as they say in the business, that gives you one throat to choke.
I understand. Does Hielix recommend a specific EHR software vendor over another?
Typically, we don't. If the client engages us and specifically requests a recommendation, that's something that we can do. But we use a process that allows us to work with each of the individual practitioners in the doctor's office to understand exactly what their workflows look like and what's important to them in an EHR software product. Then we create specific characteristics or qualities that we're going to evaluate the 2 to 3 EHRs that they determine they'd like to demo, so we get a real apples to apples comparison. Using a process like that, the obvious choice usually sorts itself right out, and it's not necessary for us to get involved.
Okay. For physician practices who are either late to the party or are having trouble financially, has the government put into place any resources for them to help make that decision?
Oh, absolutely. First and foremost, the incentives themselves are there to support the practice in offsetting most, if not all, of the costs of implementing an EHR. But secondly, the federal government has funded about 70 regional extension centers, sometimes referred to as RECs, all over the country. And those are available to the smaller primary care physician practices. You have to be a practice of 10 or fewer physicians, but you can go to a regional extension center and receive all kinds of valuable consulting and assistance in terms of selecting your EHR product. They vary from state to state, and some of the regional extension centers do have relationships with the software vendors, and others do not. So it's just really a question of what your specific extension center is doing, and it's specific to zip code. So by going online, you can find your regional extension center that's designated to work with you.
So our last question is, for physician practices who are interested in working with Hielix, how can they reach you?
Probably the best way to reach us is through our website. We have lots of general information there, and our corporate website is www.hielix, spelled HIELIX.com.
Okay.
But to take advantage of the assessment tool that we have for practices, they should go to www.hielixehr.com.
Perfect. Thank you so much.
You're welcome.